It's now exactly 8 months since Kenya reported the first case of Covid-19, and the death toll keeps growing. 25 people have lost the battle against the virus over the last 24 hours, bringing the death toll to 1,228.
In the same period, 1,470 more people have tested COVID positive for the virus, pushing the total infections to 68,193.
Nairobi County continues to carry the heaviest burden of disease, with 649 new cases reported. 791 people have thankfully recovered from the virus, out of which 695 were from the home-based care program.
Charity Mwangi now reports that a recent study has revealed that a lot more people have contracted the coronavirus than the reported figures by the Ministry of Health.
A relaxed attitude appears to have descended upon the nation. COVID-19 fatigue, if you may. More pressing needs seem to have captured the attention of Kenyans. The hustle and bustle of everyday living amid the struggle to make ends meet has Kenyans defying COVID-19 measures. Then there are the political leaders whose political agenda trumps all else. The rallies in which crowds gather may just as well be super-spreader events. And as Kenyans drop their guard, a recent Camry report reveals that the spread of the virus is far greater than what the Ministry of Health reports. Data collected from 3,174 blood transfusion samples from 4 Kenya National Blood Transfusion Service centers across the country shows that the coronavirus has affected 8% of the population in Mombasa, 7.3% in Nairobi, and 5.5% in Kisumu.
We looked at these antibodies among blood donors in Kenya to get an estimate of how much exposure there has been in the country.
In simple terms, this could mean that out of the 3,528,940 people living in Mombasa, 282,315 people could have contracted COVID-19. 682,884 Nairobi residents may have already contracted the virus, with 39,306 people in Kisumu. Camry's data, however, is not included in the daily data from the Ministry of Health due to the absence of mass testing.
It has been impossible for us to get the reagents that they would use for those machines, essentially Roche testing kits, because the Americans blocked us. So if we could get the reagents, we have a sufficient testing capacity across the country.
The fact that most Kenyans who contract COVID-19 are asymptomatic means that the infection at times go undetected.
We got samples from different parts of Kenya through the blood bank system, and that allows an initial snapshot of how much exposure of the virus has happened in the country.
Charity Mwangi, NTV.